Hey future nurses, welcome back to Scrub and Spoon. This is your nurse here. How are you all doing? Thank you for your support on all platforms. Do not forget to subscribe, do not forget to like, do not forget to share, and leave in the comment section the best part of this review. Now, in this review, we'll be talking about isolation precautions. We are talking about the standard precautions. We are talking about contact, droplets, airborne. So we have different scenarios, okay? So watch till the end. Without wasting too much of our time, let's go right into it. Now let's go. The first question. A nurse is caring for a patient newly diagnosed with herpes zoster, shingles, with open lesions on the chest and back. Which isolation precautions should the nurse implement? Select all that apply. A, standard precaution. B, contact precaution. C, airborne precaution. And D, droplet precaution. Now, before I tell you the answer, let me break this down to you. Now, the infection these patients have is herpes zoster, shingles. They have shingles, right? But what causes shingles? Varicella zoster virus causes shingles, which is the same thing as the herpes zoster. Okay? Now, stay with me. I need to make you understand something. Varicella zoster virus is actually the virus itself, that it's what causes shingles. But varicella zoster virus also causes something else, chickenpox. Now, the first time you get infected with varicella zoster virus, you will have chickenpox, and this usually occur when you are a child. Chickenpox usually occur in children. So the first time you get infected with VZV, varicella zoster virus, which is the same virus that causes shingles, the first time you get infected with it, what it will give you will be chickenpox, which is also known as varicella. Now, when you get infected with this and then you get better, your clinical manifestation is all gone, you feel better from the chickenpox the varicella zoster virus gave you, listen to me, the virus is not gone. The virus become inactive, or it goes into latent mode in the system. So the virus, you get healed from the chickenpox, but the virus is still there, but it's just not active. Okay? Now, years later, decades later, you are now an adult. Remember I said chickenpox affects children. It can affect adults too, but mostly in children. And the first time, like I said, I kept saying it, the first time you will get infected with varicella zoster virus, it will give you chickenpox. Now, years later, decades later, you are an adult. The latent or inactive virus, which is varicella zoster virus, in you can now reactivate. And this time, when varicella zoster virus reactivates, that is the second time it will infect you infect you, it will give you shingles, which is what this patient is having. So note, varicella zoster virus causes chickenpox in children. It will affect, the first time it will affect you will cause you to have chickenpox. The second time it will activate and infect you, it will give you shingles. And that is what this patient is experiencing, shingles. And shingles, you can have lesions. When the lesions are disseminated, that is spread around the body, it is very contagious, and especially with open lesions. With my explanation, now let's go through it. Standard, contact, airborne, and droplet. Select all that apply. First, we are using standard. Why? standard precautions is used with all patients regardless of their diagnosis or their infections, and that involves you washing your hands before and after touching the patient. That involves you putting on gloves if there will be direct contact with body fluids. That involves you putting on your face shield and mask if there's going to be possibility of splash, right? That involves you cleaning equipment in between patients, like blood pressure cuff, cleaning that in between patients. That is your standard precaution. So it's used for all types of patients. So that's why we are selecting that at first. 2, contact precaution. See what they said in this question. With open lesion, if you get in direct contact with this lesion, you will get infected. So that's why we are using contact precaution. And the last one, you will see the reason why I had to take my time to explain earlier. The last one is airborne. Why? Because the virus that caused herpes zoster, which is shingles, is airborne. Do you get it? Do you get it? And that's why our answer is A, B, C. We use standard, we use contact, and we use airborne. The last one is droplet. Shingles, or the virus that actually causes shingles, varicella zoster virus, doesn't spread through droplet. So it's airborne. So that's why the answer is wrong. Let's go through the next one. A patient is admitted with suspected adenovirus respiratory infection. What PPE and isolation precautions should the nurse take? A, gown. This is also selected that apply. A, gown and gloves only. B, droplet precautions. C, contact precautions. D, airborne precautions. And E, N95 mask. Now guys, let me explain to you so you can understand. When your patients have adenovirus respiratory infections, they exhibit symptoms like, cold-like symptoms like sneezing, like coughing, like flu-like symptoms. And adenovirus is spread through respiratory droplets. That should give you an hint, right? Okay, so our right answer is B, droplet precautions, and C, contact precaution. Because B, it is spread through respiratory droplets. So the isolation precaution is droplet precaution. And C, if you get in contact with, like I said, respiratory droplets, when they're coughing, sneezing, if you get in contact with those secretions, you'll be infected. So that's why our answer is B, C. Now, let's go through the own choices. A says gown and gloves only. I've told you guys, run away from any multiple choices that says only, all, always. Very wrong. So gown and gloves. Remember, gown and gloves will be for contact precaution. But because they said gown and gloves only, because we already selected our answer as droplet precautions and contact precaution. And when you are following contact precaution, you wear gown and gloves. But they said gown and gloves only. That made that choice wrong, because you also need droplet precaution with it. And D says airborne precaution, like I've explained, is droplet. Respiratory droplets transmitted through respiratory droplet. So that's wrong. And E says N95. If you are on airborne precaution, you will need N95. So our patient is on contact and droplets. So that's wrong. So our answer is only B and C. Okay, now let's move on. Okay, which patients below require airborne precautions? Select all that apply. Oh my God. Let's go through it again. A patient with varicella. Yes. I told you varicella, which is chickenpox, is airborne. Okay? Now, a patient with mumps. No. Mumps is droplet. Now, a patient with tuberculosis. Yes. Tuberculosis is airborne. Yes. Okay? A patient with measles. Absolutely. Measles is airborne. Okay? Yes. And E, a patient with rubella. No. Rubella spread through is droplet precaution. Okay, so our right answer is A, C, D. Okay, let's go. A nurse is caring for a child hospitalized with hand, foot, and mouth disease caused by Coxsackie virus. Which precautions are appropriate? When your patients have hand, foot, and mouth disease, they have sore around the mouth, they can have blister on the hand and feet, right? And it's caused by Coxsackie virus. Okay, now what are the precautions? Let's go through it. Select all that apply to. Contacts precaution, airborne precaution, droplet precaution, neutropenic precaution, and standard precaution. So let's go through it. The first one is contact. Absolutely, because Coxsackie virus spread through contact with the blisters, contact with stool, or contaminated surface. So contact precaution is needed when your patients have Coxsackie virus. Okay. And B, airborne. Actually, no. Coxsackie doesn't spread through airborne. It's spread through droplets. So I've given you the right answer. C, droplets. Absolutely. It's spread through droplets. Okay. And D, neutropenic. No. And you might be wondering, what is neutropenic precaution? This is precaution for patients that are immunocompromised. It's like a reverse isolation. Do you know what that means? It's like, instead of you preventing or protecting the patient from infecting every other person, the reverse is the case. You are protecting the patient from getting infections from every other person. Why? Because the patient is immunocompromised. Patient that's on chemotherapy, they are immunocompromised, so you are protecting them from getting infection. So that's neutropenic isolation. And standard precaution, absolutely. So our right answer, like I said, standard is used for all patients. So our right answer is ACE, contact, droplet, and standard. Okay. A nurse is caring for a patient with tuberculosis. Which of the following action is appropriate? A, wears a surgical mask when entering the room. B, place the client in a positive pressure room. C, use an N95 respirator. And D, no mask is needed if the patient is coughing into tissue. Now we are talking about a patient that has tuberculosis, and our right answer is C, use an N95 respirator. This patient have tuberculosis, TB. TB isolation precaution is airborne. Guys, the right answer is very obvious. C, use N95 respirator, because we know that TB spread through airborne, so it's airborne isolation precaution. And when your patients have an airborne isolation precaution, you will put them in negative pressure room. Close the door behind you, because it is airborne. As they are breathing, they are infecting the air. And why do you put them in negative pressure room? Stay with me, I will explain it to you. Negative pressure room means the airflow, the pressure of the airflow in that room is low compared to the pressure of air outside the room, which is always higher. The airflow is higher. The airflow pressure is higher outside the room compared to the airflow in the room, which is low. Why? Because they put them negative pressure room, so that this way the air in the room can't go out, but air can come from outside into the room. That's why the pressure in the room, of the air in the room, is low, but the pressure outside the room is high. So the air can come into the room, but the infected air in that room, because that's why you have to close the door always, it's airborne. The infected air in the room is not going out, but air can come in, and that's why you put them. That's the function of negative pressure room. Okay, so our right answer, when your patient have TB, you put them on N95. Let's go through the wrong ones. Wear a surgical mask when entering the room. This is good for droplet precaution. not for airborne. You need your N95 respirator to go into a patient that is airborne isolated, or that is on airborne isolation. Isolation precautions, right? Because surgical masks do not provide adequate protection, so it's N95. Now, place the client in a positive pressure room. No, like I've said, it requires negative pressure room and not positive pressure room. Now, D, no mask is needed if the patient is coughing into the tissue. PPE is still mandatory. So yes, their coughing etiquette is good, coughing into the tissue, but you need to protect yourself as the nurse going in there. So you still need your PPE, you still need your N95, okay? So that is wrong. Let's go through the next one. Now, which of the following in clients require droplet precaution? We're talking about droplet now. Mumps. This is selector that apply. Mumps, absolutely. Okay, mumps is droplet precaution. Now, RSV in a child, yes. Respiratory syncytial virus is spread through respiratory droplets, and it is droplet precaution plus contact precaution. So yes, RSV require droplet precaution. Now, rubella also droplet precaution. Okay. D, pertussis, which is whooping cough, absolutely droplet precaution. And E, tuberculosis, airborne. Okay, let's move on. A nurse enters the room of a client with C. diff without gloves but doesn't touch anything. What is the nurse's priority action? A, report to infection control. B, document the event and move on. C, wash hands with soap and water. D, use alcohol-based sanitizer immediately. I believe you know the right answer is C, wash hands with soap and water. Guys, let me tell you something with C. diff. Highly contagious, right? Even when you wear C. diff is contact precaution. Even when you wear your gloves and gown to take care of patients on C. diff isolation precaution, when you come out, after taking out that gloves, you must wash your hands. Proper hand hygiene, not sanitizing it. Washing, you need to wash it. Okay, so that's why that answer is right. Now let's go through the wrong choices. Report to infection control. Report is not the immediate priority. Okay, so that hand, you're not gonna wash it, but you're gonna pick up the phone, even though you do not touch anything. But it's the protocol. You just don't know how. Okay, guess what? You might not even touch anything in the room, but on your way out, you might touch the doorknob. And you do not know who have been there before. If they've used glove hand to touch the doorknob. But because you go in, you just ask question, you didn't touch anything, but you touched the doorknob on your way out. So now you came out, instead of you going to wash your hand, you went to pick your phone, you've contaminated your phone to call the infection control. That's not the immediate priority. The immediate priority is to wash your hands, to reduce any possibility of spreading that infection. Wash your hands. Okay, now B, document the event and move on. That's not the first action. Okay, and D, use alcohol-based sanitizer immediately. Let me bust your bubble. Alcohol-based sanitizer doesn't kill C. diff. Proper hand hygiene, proper hand washing does. Okay, and that's why those answers are wrong. Our right answer is wash your hand with soap and water. A patient with suspected measles is admitted. Which action should the nurse take first? Measles. Place surgical mask on the client. That's A. B, place the client in a private room with closed door. C, begin droplet precautions. And D, notify housekeeping for enhanced disinfection. First off, you need to know that measles is airborne. Right? Once you know that measles is airborne, the right answer will be place the client in a private room with closed doors. I've explained this. Airborne. You are closing the door because you don't want the infected air to come out. And you are putting them in negative pressure room. I've explained why. So that the infected air doesn't come out, but air can go in. Okay? That's why you are closing the door behind you. Now, let's go through the wrong choices. Place surgical mask on the client. That is helpful, but it is not the first step. Okay, you want to place surgical mask on the client. Remember, surgical mask does not protect. You're still breathing through the surgical mask. Okay? Does not protect you from airborne infections. Surgical mask does not protect you from airborne infections. So you can place surgical mask on them, but so long they are breathing, the hair can still come out and still be infected. So the first thing is to isolate them first so they don't pollute the air. Okay? Now, C, begin droplet precaution. No, it's not droplet, it's airborne. And D, notify housekeeping for enhanced disinfection. It's not immediate priority. The immediate priority is to isolate. Now, let's move on. Which infections require both contact and droplet precautions? A, influenza. B, MRSA, pneumonia. C, norovirus. And D, tuberculosis. And the right answer is MRSA and pneumonia. MRSA pneumonia requires droplets for respiratory secretion, and it also requires contact for contaminated surfaces. So that's why your right answer is B. Now let's go to the wrong choices. Influenza, which is like the flu, it is droplet, it's spread through respiratory droplets, so it's droplet precaution. Norovirus is contact precaution. Okay, and tuberculosis is airborne precaution. So our right answer is B, MRSA pneumonia. Now listen to this one. Which of the following patients would be appropriate to cohort, that is put together in a room? Put together in a room. A, 2 patients with confirmed RSV. B, 1 patient with C. diff and 1 patient with norovirus. C, 2 patients with measles. D, 1 patient with pneumonia, 1 patient with influenza. And E, 2 patients with MRSA wound infection. Let's do it. Select all that apply. Now, A, let's go through it together. 2 patients with confirmed RSV. Absolutely yes. Respiratory syncytial virus. You can cohort these 2 together because they have same infection. RSV. So you can cohort them together. Now, B, 1 patient with C. diff, 1 patient with norovirus. Absolutely not. Now look at this. Both C. diff and norovirus are contact precautions. So you might think, oh, they both gonna go in contact isolation. Now here's the twist. Now both C. diff and norovirus, they have different pathogens, and that is why you cannot cohort them. Why? Because C. diff is a bacteria infection. It's caused by a bacterium infection, while norovirus, just like it implies, it's a viral infection. So why would you put them together? So no, that makes it wrong. They have different pathogens. So even though they are both contact precautions, but they have different pathogens. Okay, now let's go. See, 2 patients with measles. We know that measles is airborne and it requires private room. And if you put 2 patients with measles in the same room, right, the air will be infected in that room. There will be cross contamination, because if bed A have had measles for a while and they're about to get healed, but because bed B just started experiencing symptoms or exhibiting symptoms, the bed A will not get heal quicker because reinfection. So that's why measles requires private room. Now, D, one patient with pneumonia, one patient with influenza. They still have different pathogen. Now, pneumonia can be viral, can be bacterial. It's an infection. It can be bacterial infection, viral infection, fungal infection. So you don't know which one it is. And one with influenza is viral infection. So they have different pathogen. There'll be cross infection, cross contamination. So you don't want to put them together, even though they are both droplet precautions. Okay? Now, and the last one, 2 patients with MRSA wound infection. Now, these 2 patients can be cohorted because they have same pathogen. MRSA wound infection, MRSA wound infection. So our right answer, the 2 options of patients that can be cohorted together are A, 2 patients with confirmed RSV, and E, 2 patients with MRSA wound infection. Okay, let's move on. Which personal protective equipment, PPE, is required when caring for a patient with scabies? A, gloves only. B, gown and gloves. C, surgical mask only. And D, N95 respirator. I hope you know this. Scabies is contact precaution. Okay, so the right answer here is gown and gloves. I've told you guys to run away from only, so gloves only. No, that is wrong. Surgical mask is for droplets, and it says only too. Wrong. N95 is for airborne. So our right answer is gown and gloves, and scabies is contact precaution. Now let's move on. A nurse is assigned to care for a client with meningococcal meningitis. Which is the best appropriate isolation? A, airborne. B, contact precaution. C, droplet precaution. And D, neutropenic precaution. And the right answer is C. Why? Because meningococcal meningitis is transmitted through droplet transmission. So that's why the answer is right. Okay. Now, airborne, no. Airborne is for measles, chickenpox, which is varicella. So that's for airborne. And contact, like we said, contact, just like we mentioned, contact is for C. diff, scabies. Okay. Neutropenic. This is a reverse isolation for patients that are immunocompromised. It is used to protect the patient against infection, not protecting others against the infection. You are protecting the patient. The patient is priority in reverse isolation, which is neutropenic isolation. Now let's go. A nurse is assigned to care for a patient with C. diff infection. Which actions should the nurse take? Select all that apply. A, wear a gown and gloves when entering the room. B, perform hand hygiene with alcohol-based sanitizer upon leaving the room. C, use bleach-based disinfectant to clean equipment. D, place the patient on airborne precautions. And E, wash hands with soap and water upon exiting the room. Let's go through it. Select what I apply as true and false. Now let's go. A, wear a gown and gloves when entering the room. Absolutely. C. diff is contact precaution. Yes, absolutely. Perform hand hygiene with alcohol-based sanitizer upon leaving the room. They want to trick you. The first half is good. Perform hand hygiene. But they said with alcohol-based sanitizer. No, alcohol-based sanitizer will not kill the C. diff spores. So that is wrong. C, use bleach-based disinfectants to clean equipment. Right? Now, bleach-based disinfectants are effective for environmental cleaning. So that is good. Now, D, place the patient on airborne precautions. I just literally told you guys it's contact. So why would you place them on airborne? Okay? Don't do that. Now, wash hands with soap and water upon exiting the room. Absolutely. Wash that hand. See, you wash your hands for about 20 seconds, right? While you are singing happy birthday, you wash. Okay, so our right answer is ACE. Okay, and the last one, guys, the very last one. Thank God we made it till the end. Please do not forget to support by subscribing, by liking, by commenting your best part of this review in the comment section, and I will be replying. Now let's do the last one, guys. Okay, a nurse is caring for a patient diagnosed with rotavirus. Which of the following nursing actions are appropriate? Select all that apply. A, place the patient in a private room. B, wear a gown and gloves when entering the room. C, use N95 respirator. D, practice strict hand hygiene with soap and water. And E, use droplet precautions. So guys, let's go through it together since it's select all that apply. Now the first one say, A, say place patient in private room. Yes. Why? Because rotavirus is highly contagious and it is easily spread through contact with stool or contaminated surface with rotavirus. So a private room is needed. If a private room is not available, cohort the patient with rotavirus with another patient that is infected with rotavirus. Okay, so if a private room is not available, you should cohort a patient infected with rotavirus with another patient with rotavirus. Okay, they have same infection. That's why you can cohort them. But if a private room is available, please put them in a private room, because private room reduces cross-contamination to other patients. Does that make sense? So that makes sense. Now B, wear gown and gloves when entering in the room. Absolutely, like I said, it is contact precaution. Do not mix it up because we are putting them in a private room as airborne. It is contact precaution. It is just because it is highly contagious. You can put them together in a room with a patient that also have rotavirus. It is highly contagious. If you get in contact with the stool or the surface that have rotavirus, highly contagious. Okay, and that's why. So gown and gloves is contact precaution, prevent against contaminated stool, vomit, so that's why you should put on a gown and glove. Now D, practice strict hand hygiene with soap and water. Absolutely, because alcohol-based sanitizer is less effective against some virus such as rotavirus. So do your hand hygiene, proper hand hygiene. Wash your hands with soap and water. Now let's go through the wrong ones. Use N95 respirator. It is not airborne, so N95 is not needed. Now let's go. E says use droplet precautions. It is not droplet precautions. So like we said, it is gloves and gown contact precaution. I hope you've learned something in this review. Until the next time, take care of yourself.